Hello, I'm Puneet Monga. I'm a consultant shoulder surgeon. When one has to consider the option of surgery, one has to discuss various options of treatment, not only the option of surgery, but also the option commonly of doing nothing and the option of non-operative treatment, especially relevant in conditions which are to do with quality of life. One has to consider whether a particular condition does indeed need surgery. One can also consider a non-operative course of treatment such as physiotherapy or a minimal interventional course such as an injection. Surgery, of course, is an option, and one weighs up the benefits of surgery against these other two options. One has to consider the risks and benefits of all these options. Non-operative treatment, although in the first place sounds like a very safe option, one has to consider the risk of a condition in the long-term well-being and long-term health for yourself. So when one considers a particular surgery, you always have to consider the risk of a certain surgery. A vast majority of shoulder operations that are performed are extremely safe and people get excellent outcomes with minimal complications. However, no surgery is guaranteed, and one has to consider the general and the specific risks from a certain operation. The general risk, for example, of any operation is risk of infection. Now, risk of infection after arthroscopic shoulder surgery is much less than 1%. However, it is relevant and it's important because it's quite a significant event. Other risks like bleeding is very rare. Risk of injury to nerves and vessels is again very rare. Specific risks for a particular operation, like risk of redislocation after instability repair, risk of loosening of an implant after a shoulder replacement, or risk of re-tear after rotator cuff repair, has to be specifically discussed by your surgeon with yourself, judging by your clinical condition and the overall picture. When one considers the benefits of a particular surgery, the overall success rate of any surgery is dependent on the condition, whether previous surgery has been done, and the overall medical condition. However, usually speaking, a vast majority of arthroscopic shoulder surgery will lead to a significant improvement in symptoms in over 90% of the case. This is general advice. However, one needs to discuss this specifically with the consultant looking after you.